Hello friends, I am Dr. Haribala Mahapatra from Bhubaneswar. Today we'll learn about some of the basics of diabetes. We know that diabetes is a chronic disease that occurs when the blood glucose is very high. Glucose is derived from the food that we usually eat. And in diabetes, the pancreas is no longer able to make insulin, or the body cannot make good use of the insulin that our pancreas produces. So insulin helps the blood glucose to pass from the bloodstream into the cells of our body to produce energy. All carbohydrate foods are broken down to glucose in our blood. So there are three different types of diabetes. One is type 1, type 2 and gestational diabetes. So certain other types of diabetes are also there, called the other forms of diabetes. In type 1 diabetes, it can occur at any age but occur most frequently in children and adolescents. When someone is having type 1 diabetes, the body produces very little or no insulin at all, which means the person will be requiring insulin from the outside, maybe in the form of injections, to maintain their blood glucose under the range. And in patients with type 2 diabetes is more commonly seen in adults and accounts for almost 90% of all the diabetic cases. And when someone is diagnosed with type 2 diabetes, the body doesn't make good use of the insulin that it produces. And there are several risk factors which are associated with type 2 diabetes, namely a family history of diabetes, being overweight or obese, unhealthy diet, physical inactivity, increasing age, high blood pressure, etc. And the cornerstone of type 2 diabetes treatment is healthy lifestyle, including increased physical activity and healthy diet. However, over time, most of the people with diabetes, they will be requiring oral drugs, tablets, or maybe insulin to maintain their blood glucose under the stipulated range. And the other type, as I told, gestational diabetes, is a type of diabetes that consists of high blood glucose during pregnancy. It is associated with complications for both the mother as well as the child. It usually disappears after pregnancy, but women are affected and their children are high risk of developing type 2 diabetes in the latter part of their life. So thank you very much for your patience hearing.